Hi, I'm Dr. Ashley Mack of Ashley Mack Performance and Rehab. Today I'm going to tell you about how to use a foam roller to help relieve some of the knee pain that you might experience that could be related to some sort of quad tightness. Now, our quads are probably one of the strongest muscles in our body, and in most cases, they're also the ones that are constantly active and constantly firing. When we're sitting down, they're in a short position, but when we're standing up, our quads are somewhat active. And so, in some cases, when your quads are super active in relation to your hamstrings or other aspects of your hip, it could put a lot of pressure on your knee and cause knee discomfort. So this is where the foam roller, or in some cases, if you don't have the foam roller, you can use a wine bottle and throw a towel right on top. It'll serve the same purpose. So we're going to be addressing the quad muscle. There's four bellies of the quad. You have the inner, middle, and the outside, and you have one that's even deeper. Now really the idea is the following. You're going to take your foam roller, you're going to put it onto the floor, and you're going to rest your thigh right on top of your quad, which is going to be between the top portion of your knee and the base of your hip. You're going to get onto your stomach, you're going to use your hands to just secure yourself, and you're going to use your hands and your other hip as an opportunity to roll up and down. And you're going to find those areas that might be a little uncomfortable, also known as sticky spots. I'm going to show you what it looks like on the other end, so what you can do with the free leg. As you can see, my free leg is actually resting on the floor. It gives me an opportunity to have a lot of control on top of that roller. Now, 90 seconds should be able to do the trick. If you want to spend a little bit more time, you want to spend a little less, that's perfectly fine. I prescribe to my patients about 90 seconds per leg. Now, what is actually happening when we foam roll? Well, I'll tell you what's not happening. We are not breaking up scar tissue. We are not breaking up the fascia. Now, interestingly enough, when it comes to the research, it actually takes a lot of force to break up any sort of fascia or scar tissue. So what might be happening, and I say might be because there could be research that refutes this, but what we're doing is we're providing what is called a neurological stimulus. We're taking signals and we're sending it through the muscle up to our brain, and we're having this constant feedback loop to allow that muscle to either turn on a little bit more or for that muscle to calm down, so then that way the mechanics of the joint can move a little bit better. So I would suggest if you're experiencing a little bit of knee pain, whether it be kind of like around, like pretty much anywhere around here, and you're rolling out and you notice that one side, the affected side, is a little bit more tender than the other, roll that out and spend a little bit of time, 90 seconds, and make sure that you're breathing. Because if you're not breathing and you're holding your breath, you're actually creating a ton of tension, which is only going to make things even more painful. Now again, knees are pretty complicated. They can either be an easy treat or not at all. And if this doesn't really help out with your symptoms, then it's really not the end of the world. But if that's the case, I encourage you to click on the link below and book a consultation call with me.